Occupational therapist Sylvia Koreen has agreed to show us some practical items that can help with adaptations to daily living activities. Sylvia, what have we got here?
Wow, we have quite an assortment of different items that you would want to use to assist people to keep on track and stay organized in their daily lives.
Okay, well, let's get right into it. What about this blouse? I was having a look at it. It's got Velcro on it.
It does. So one of the things that can happen with an individual that has dementia is it starts to become more difficult sometimes to open buttons, zippers, those types of fasteners, and then of course it makes it more difficult to get dressed. So to keep their independence, you can use Velcro as a really good fastener for shirts. Also, you know, we think about putting Velcro on shoes and that when it becomes difficult to tie shoes. So Velcro is a great way to fasten items. And if you're not a seamstress yourself or have somebody that can sew that for you, quite often you can go to a tailor or a seamstress and have them adapt clothing for you that way.
Oh, excellent. Thank you.
Welcome.
And what about these calendars?
Yes, it's always a great idea to have a calendar in a very visible place for an individual so that they can remember where they are and when they are. That's certainly one of the things that is affected with dementia. And so if they have a place in the kitchen or somewhere where they're able to look up and see exactly what day it is and what's going on, it's always very helpful. Now you'll also notice that these two calendars are a little different, and you would want to use a calendar that is very clear and simple to read. You'll notice this is very simple. It's black on white. The numbers are big, whereas this calendar tends to get quite busy. It's got different colors on it, and it's quite distracting and hard to read, but this is easier to follow. So something to think about is keeping it simple.
Oh, interesting. I wouldn't have thought of that. Yeah. Now, these are obviously to do with keeping track of medications. Can you talk about some of these?
Absolutely. So when it comes to, you know, getting a little older and needing to take different medications for not only your, you know, mental abilities, but also physical abilities, it becomes a lot easier to be able to remember when to take them if you're using some kind of organizers. And these are two examples of different organizers. This is one that you'll find in the drugstore. It's called a dosette, and this particular dosette is for 1 week. You can get them for a month or what have you, and it's really helpful for the care provider to organize the person's pills for the week so that they know, you know, on Sunday that they need to take these, etc., etc. So it really keeps them organized. The other nice thing about this and also the blister pack is that it helps if a care partner is coming in just to check in on somebody, and they can go back and also check and see which pills are gone and so to make sure that the person is taking their pills when no one else is around. Now this dosette is something that you would fill on your own, and this is called a blister pack, and typically you'll have all the different pills in these little packs, and these are actually made up by the pharmacists. So a pharmacist will take the person's medication and they can actually put all this together, and then a person knows when to take their medications. They're taking them Monday through Friday or Sunday, and what time of the day even. Again, it's a really great way for a person to remember, and also for a care partner to cue that individual that they're taking their medications.
Yeah, that would be so useful.
Yeah.
So now this obviously has to do with mealtime. What's going on here? Can you talk about this?
Sure can. You know, when we think about setting a table for eating, we quite often will, you know, tend towards something that's really pretty, and we like color and pattern, but it's really important to recognize that a person with dementia may start to get really confused by something that has a lot of pattern. So for example, if you have a placemat, a simple colored placemat, and then you put a really, really busy plate on there, all of this going on can, to a person with dementia, it can look like food. And they'll be starting to pick at the berries here and not be able to actually eat their meal. And, you know, it's really important to recognize that a person with dementia may start to get really confused by something that has a lot of pattern. So for example, if you have a placemat, a simple colored placemat, and then you put a really, really busy plate on there, all of this going on can, to a person with dementia, it can look like food. And they'll be starting to pick at the berries here and not be able to actually eat their meal. properly. But if you keep it simple, it makes it much easier to do so. So taking, you know, a simple colored tablecloth or a placemat, and then having a contrasting plate on there. White is always a good choice. It makes it very easy to be able to see what is food and what is not. It makes it easier for that person to carry on and just eat like everybody else.
Now, how about these items? What have they got to do with?
Well, when we're looking at some of the items, certainly in the kitchen, it's also, you want to recognize that some things are really hard to, when they're so small like this, sometimes it's really hard to know the difference between one thing and another. A really good example would be looking at different containers, one containing sugar and one containing flour. The difference is so minute that an individual with dementia might get them mixed up.
Sure.
So it's really important to label items very easy to read, so that a person doesn't accidentally think that the bird seed is something that they should be eating for dinner. So you want to label things. Make it really easy for a person so they don't make those mistakes.
Well, thank you, Sylvia. These are some great ideas. Thank you very much.
You're welcome.